Hi, this is Dr.RUkmani Choudhary and you are watching Dr.RUkmani's Health Update. My today's topic is a weakness, fatigue, that is called medically asthenia. So I'll be talking about what is asthenia, what type of asthenia we'll talk about, and what are the causes for asthenia, weakness. There are certain disease, certain medicine, medical illness, post-treatment, post-infection, and what are the symptoms, associated symptoms, so what type of asthenia you have, what are the tests required, what are the diagnostic criteria to access final diagnosis for the asthenia, what are the management part, effective homeopathy medicine. I'll be talking. Requested to watch complete video for complete information. If you're watching first time, don't forget to subscribe my channel. Please press the bell icon to get notified. So what is a weakness asthenia? So this is a kind of feeling, sort of feeling that you feel, lethargic, you feel tired, you are not able to move your affected body part. So it can be, for one body part, like it can be isolated and it can be generalized, means you can have all body weakness. So this is how you develop weakness. Causes for weakness, what medical condition? See, there are certain medical condition like in thyroid, yes, you have weakness, fatigue, lethargic. In hypoglycemia, means you are having low blood sugar, in that case you have weakness. In low blood pressure, it means hypotension, you have weakness symptom. In cancer, yes, you have weakness. And in cancer treatment like chemotherapies and radiotherapies, you have weakness. There are other deficiencies, disorder, like if you are having a vitamin B12 deficiency, you have weakness. You are having anemia, you are having iron deficiency, in that case you have weakness. And in anxiety and sleep, you are not having enough of rest, yes, in that case can be side effect of certain medicine that I talked about, like after chemotherapies and radiotherapies, you have even after injury. And weakness you can develop steadily, gradually, or you can develop it all of sudden. So in heart attack and in stroke cases, these are other medical condition in which you develop all of sudden. Can be gradual onset and all of sudden. Sign or symptoms means what other symptom you have along with weakness. So you have weakness, you are not able to move your affected body part. This can be isolated, means certain particular body part you are not able to move, and this can be whole body, means you are not able to move at all. So this can be generalized, this can be isolated. As other symptom, like you are not able to move, you are there is a trembling and there is a loss of sensation, this can be associated with weakness. And emergency symptom, if you are unconscious, if you are having confusion, lightheadedness, and yes, if there is a pain in certain particular area, like you can have chest pain, persistent pain. So if you're having pain, lack of concentration, confusion, vision problem, orientation problem, difficult breathing, so these symptoms can be alarming symptom, and you must see your doctor or you must visit hospital right away. So these are the symptoms. Even post COVID, after some flu and after some fever like COVID, post COVID, you develop weakness. Diagnosis part, what are the tests required, and what are the criteria for diagnosing weakness? See, we already discussed in the causes part that this can be symptom underlying disease. So our basic principle, basic concept should be ruling out of the other medical illness and approaching the right disease part. So test can be your blood test, your iron test, whether you are not having a weakness due to iron deficiency, your complete blood count, your urine, your thyroid profile, that you are not having weakness due to thyroid, so thyroid must be ruled out, anemia must be ruled out, urine test, KFT, LFTs test, these are the basic tests to be done. And feeling persistent pain, means diagnosis always focus on your collection of your symptom as well. So if you are feeling persistent pain anywhere in your body, so for that X-ray can be done for that part, and X-ray, CT scan and MRIs can be done for that particular part ruling out the main cause. Feeling weakness all of a sudden, you could have a heart attack, you could have stroke. So for that, brain MRIs can be done and ECG can be done, and there are other tests can be done if there is other symptom associated. Management part or treatment part. Treatment always focus on your cause, like what cause you are having, what symptoms you are having. So if you are having iron deficiency, then you are provided iron supplementation. If you are having thyroid, you are provided thyroid treatment. If you are having low blood pressure, you should maintain your diet. And if you are having low blood sugar, so in that case always focus on the cause, the disease, the medical problem you are having, and because of that you are having weakness. Homeopathic treatment for weakness. There are so many medicine in homeopathy. Homeopathy always works on collection of your symptoms, the totality of your symptom, what symptom you're having. So I have divided certain groups, like we will discuss group wise. So if you are having weakness due to nervous origin, means you are having nervous problem, and after that you are feeling weakness. So there is Nux, Vomica and Kali Phos. There are two medicine. You can use Kali Phos if you're having lack of confusion, memory loss, and you can use Nux, Vomica. Yes, your origin is nervous, but you're having gastric problem and your excess use of alcohol. In that case, you can use Nux, Vomica. Now, use one medicine at a time and try to analyze your case, try to collect your symptom, try to match your symptom with the medicine. And if you're watching on YouTube, I have provided medicines link on description box. You can buy medicine from there and you can start your treatment. So this is Nux, Vomica in 30 or 200 potency, 1 or 2 drops, twice or thrice before meal orally. On if you are a male and you have excess sexual abuse, so in that case there are 3 major medicine in homeopathy: acid, Phos, selenium and Asthenia. So if you are having weakness after seminal fluid loss, there is acid, Phos and selenium medicine at a time. These are the medicine that is used if you are having weakness due to sexual abuse and even after seminal fluid discharge. So you can use one medicine at a time. With the help of dropper, you can use 1 or 2 drops twice or thrice before meal regularly, like till the time you start feeling better. Use when you dwell your thoughts are related to Asthenia, means sexual thoughts, dwelling on all these thoughts. Aged, elderly patient, if you are aged, if you are elderly patient, in that case there are two major medicine: Ambra Gracia and Conium Max. So you can use one medicine at a time. So you can use Conium Mac in 30 or 200 potency, 1 or 2 drops twice or thrice if you are feeling weakness due to your weakness after fever. See, this is a common symptom that after any sort of fever you have weakness, like post-COVID, after typhoid, after any dengue, chikungunya, after fever, after flu, you develop weakness. So in these cases there are major medicine in homeopathy: Gelsemium, Cinchona. Here Gelsemium is the medicine that is used after fever weakness, post-fever weakness. Gelsemium in 30 or 200. This is the potency, and the color is other color medicine. There is no problem. Just focus on the medicine name. That's it. Company can be anything, and the potency can be like 6, 12 or 30 or 200. Start with the lower potency. Cinchona again homeopathy medicine that is used after fever. And if you develop weakness after loose motion, diarrhea, yes, there is Cinchona again, Arsenicum album. We give Arsenicum album after food poisoning and you develop dehydration and eventually the loss of fluid. So in that case you can use Cinchona as well as Arsenicum album, but one medicine at a time. Due to anemia, means you are having iron deficiency, so in that case you are provided iron supplementation or homeopathy medicine like Ferrum, Phos, Ferromat or even Cinchona. So if you are having weakness of like iron deficiency, that is used. There are other medicine as well. Homeopathy medicine alpha tonic with ginseng. This is given when you have weakness, loss of appetite. Tonic 1 or 2 spoon twice or thrice before 30 minutes of the meal or after having 30 minutes of your meal. And this is again homeopathic tonic, alpha tonic. This is again used for weakness purpose and very effective. Video can help you. If you find knowledgeable, informative, please like and share. Don't forget to subscribe my channel. Press the bell icon to get notified, and I have put end screen on the videos in for the further and detailed information. Thank you for watching. Thank you for your support. Stay safe, stay strong. Thank you.